The creative arts therapies currently available at Riley Hospital for Children include art therapy, music therapy, and dance movement therapy. This video will describe art and music therapy and how they can help patients and families at the end of a patient's life. Art therapy is the clinical use of art materials within a therapeutic relationship to achieve various emotional goals. Pediatric medical art therapists are master's-required licensed counselors who help patients and caregivers cope and process their experiences through a combination of active art making and psychotherapeutic techniques. With a background in psychology and counseling, art therapists can provide therapy for either patients or their caregivers. Riley Art Therapists are 100% donor-funded and therefore do not bill for their services. Generous contributions through the Riley Children's Foundation make art therapy completely free for Riley families. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship. Music therapists have completed a degree in music therapy, a 6-month internship, and have passed a national examination. They create individualized treatment plans to help patients and families cope with their hospital experience. Music interventions may focus on distress tolerance, functional skill reinforcement, or resilience. Our music therapy program is generously funded by the Riley Cheer Guild. Riley Creative Arts Therapists use their creative medium to work towards goals such as management of physical pain and emotional distress, maintained or improved levels of physical, psychological, or cognitive functioning, resilience, which is the capacity to recover quickly from difficulties, emotional expression, reduced symptoms of anxiety and depression, increased sense of control and mastery, family support and bonding, positive coping strategies in the hospital and after discharge, grief and bereavement support, including legacy projects. The creative arts therapies can help patients and families across a wide spectrum of needs. Sometimes patients may simply need materials and resources and will then be able to use their own creativity to help themselves cope more positively with their hospitalization. In this situation, an art therapist may give the patient art materials, or a music therapist may lend them a guitar to use during their stay. On the other end of the spectrum are patients who are experiencing more significant stressors, such as physical or emotional distress, lack of social support, or medical setbacks. When significant stressors are identified by the medical team, an order for music therapy or art therapy can be entered into Cerner. These patients and/or caregivers are then assessed by the therapist, and a treatment plan is developed that can help support their varying needs. While creative arts therapies are only available to inpatients at this time, patients and their caregivers can be followed by the same therapist throughout their medical journey, no matter what unit they move to throughout the hospital. Creative arts therapists can provide the greatest assistance to a family facing upcoming end of life by working with them in the days, weeks, or months prior to the patient's last day. During this time, a variety of creative media can be used to help patients and family members express their feelings and create legacy projects such as art pieces or song recordings. These types of interventions are most successful when the therapist has the time to build a deep relationship with the patient and family. Even if there hasn't been an opportunity to develop a relationship with the patient and family, an art therapist can create sterling silver fingerprint charms at end of life. Using a small piece of metal clay, art therapists obtain a fingerprint by pressing the patient's hand or foot into the clay for an exact impression of the patient's print. This is then fired and turns to sterling silver that will last forever. The chain is attached and the product can be mailed to the family when needed. Art therapists are also very willing to help with calligraphy and handwriting on other memory-making items. If you are working on memory items for a family and would like an art therapist's help, feel free to call Art Therapy on Vocera to see if anyone is on site to assist. Many staff in the hospital can record a patient's heartbeat for the family. A music therapist can take it one step further by adding music to the sound of the patient's heart.
My only sunshine, you
family requests a particular song that the patient loved, or they ask the music therapist to record a song the patient wrote during their music therapy sessions.
Dear, how much I love you.
Music therapists can also provide live music in the room during a patient's final moments to create a more peaceful environment, to support the family, or to promote comfort for the patient. You can consult art therapy or music therapy by putting in a Cerner order. Please write in a reason for the consult to help us know how we can best assist your patient. You can also consult us verbally by calling art therapy or music therapy on Vocera, or you can email us at rileyarttherapy@iuhealth.org or rileymusictherapy@iuhealth.org. Thank you for watching this presentation, and feel free to reach out if you have any questions about our services.